brought 12.
I have never seen anything more spot on. Bringing critically ill patients to CT is an art. You've got all your things, your drips, your IV pole, you've got your chest tubes, your drains, your Foleys, your vent. Like, you are bringing in like a lot of stuff. And it is a lot to manage, and you're just like casually bringing the most critically ill patient to CT, and you're like, hey, like, I'm here with room 12. These are some of the things that I like to do before and like during, whenever I am leaving the ICU with a patient and taking them to like a scan, like CT, MRI, or some sort of procedure. First thing is I like to make sure all my drips are good. I'm not going to run out of anything, and if I need to bring an additional bag of that medication, I bring that. If my patient is going to need additional sedation or pain meds or something, I make sure I have orders for those and either bring them with me or give them before we leave, depending on, what type of medication, how long it takes to work. Bring all your emergency equipment with you. Your ambu bag, you should have an oxygen tank, even if your patient is like not hooked up to the ventilator. I also make sure that I have portable suction if I need it. Empty all your drains and Foleys and everything before you go to whatever scan, because when you're moving patients, things get tipped and then your eyes and nose won't be accurate, and then like I'll have a stroke. Always make sure to tell somebody that I am leaving with that patient and where I'm going to. That way, if I call for help or like there's an emergency, they know where I'm at. If I'm unsure if the patient is going to tolerate laying flat for whatever scan or procedure, I will trial that at the bedside before we go to the procedure. Make sure your monitor has enough battery life and you have all of your monitoring cables for whatever you're going to need to monitor. Even if you're like, oh, it's a quick scan, I shouldn't need to check a blood pressure, you're still going to bring your blood pressure cable and equipment. When you're managing so many tubes and cords and all that stuff, like, I try to keep everything as like clumped together as I can. So like all of my IV tubing is going to be in one little batch, right? Like, it's not going to be intertwined with my monitor tubing. I mean cords, but you get the point. My monitoring cords are going to be their own little unit, so that way nothing is crisscrossed. It's going to be messy. You're going to end up untangling things anyway, but it's a lot easier to just kind of have everything in their own little clumps and units whenever you're transferring a patient from one bed to another. Make sure you have enough slack on everything, and that when you are traveling to the scanner or wherever you're going, you are one unit with your team. Road trip emergencies are not fun. So you can see we do a lot of things to prepare before we go to any scans or procedures in order to prevent anything from happening or be prepared if something does happen.